Everything that we do is centered with evidence. We have to be clinically informed by what the best available evidence is at that time. But at the same time, I think we also need to realize as clinicians, as researchers, as an organization, the limitations of the evidence, whether it's the designs, whether it's the interpretation of the information, and the context could be so very different. If I'm in North America, if I am in Europe, wherever I am in the world, the context and the person in front of me is so very different. And the makeup, we just don't have a one-size-fits-all.
Welcome to the Hands-On, Hands-Off podcast brought to you by AAOMPT, the American Academy of Orthopedic Manual Physical Therapists. And today we're really excited to launch the first of 4 podcasts, including IFOMT. So this is an AAOMPT IFOMT collaborative. And so over this series, we're going to bring you various conversations with internationally recognized speakers in orthopedic manual physical therapy. So we're really excited to launch this new series.
And I'm Megan Donaldson. I'm the president of AAOMPT. And of course, I have Amy McDevitt, who's joining us as a member at large for our AAOMPT organization. And together today, we are thrilled to join a colleague and friend, Dr. Paolo Sanzo, who is the president of IFOMT.
So Paolo is an associate professor at Lakehead University and the Northern Ontario School of Medicine University, director of active potential rehabilitation services, and a clinical specialist in musculoskeletal physiotherapy in Canada. He's also a lead instructor and examiner for the IFOMT accredited Advanced Integrated Musculoskeletal or AIM program of the Canadian Physiotherapy Association. Paolo is also currently the president of the IFOMT organization.
And in this episode, we want to explore the IFOMT vision a bit more. And Paolo has had such a rich contribution to this over the last many years, and its role in shaping global standards for manual and musculoskeletal physical therapy with an international collaboration, and what that means for patients and clinicians worldwide.
So let's go ahead and get started. Paolo, first, again, we want to welcome you. Can you give us just a little bit of a background on yourself, if there's anything that wasn't covered in your introduction?
Thank you very much, Amy and Megan, for the opportunity to be here today. And thank you for the very, very kind words and introduction. I guess the other thing is, other than physiotherapy and being a professor at a university, I'm also, the husband of a wife that's an occupational therapist. And I have 2 wonderful daughters as well that are young adults, one in university still, and one that is starting her career as a nurse and going on to grad school and more education in the future. And I'm here in northwestern Ontario, just north of the Minnesota border as well, and had some snow overnight.
Yeah, and it's probably very cold.
Well, you know what? It's been unseasonably warm, believe it or not, but we've had the last week or 2, things are changing, and you can definitely get a flavor that winter is coming.
That is great.
Well, thank you for being here despite the cold and the need to shovel outside, as you mentioned previously. So I'm going to dive in. And what I wanted to start talking about first, Paolo, is really IFOMT. So for listeners who may not be familiar, can you tell us a little bit about what IFOMT is and what makes it unique in the global physiotherapy landscape?
That's a great question and a great place to start. For people that aren't familiar with what IFOMT is exactly as an organization, I think we start first with World Physiotherapy. World Physiotherapy is the representative organization globally for all physiotherapists that work in different areas of practice. And they have specialty groups that represent different very specific or very unique niche-oriented special interest groups. And IFOMT represents the physiotherapists that work in manual and musculoskeletal physiotherapy. And essentially, it is the oldest, it is the largest representative group for physiotherapists around the world, and it is a global representative.
And so tell us a little bit about the history of some of what your involvement has been in IFOMT over time.
Yes, so I was originally part of IFOMT as the junior delegate representing Canada, and worked with our sort of delegate at the time to kind of learn and see what the role was exactly of the delegate representing Canada. I then was appointed as a treasurer for the IFOMT Executive Committee, so had the capacity to kind of learn a little bit about the finances and the finance side of a global organization. I then sat in the vice president's role for 4 years and had the opportunity to work with an amazing executive at that time, trying to implement strategy and change and listen to the delegates and what was happening around the world. And in 2024 at the Basel conference, I had the opportunity to now be elected into the president's role, which I currently sit in at this time.
Yeah, and congratulations. Megan and I were both there for that. That was really exciting. It was a wonderful conference. It was so neat to have all these different people from different parts of the world come together and talk about topics that they're passionate about. And so, IFOMT has been around since 1974. How do you believe the organization has really grown over time?
Wow, it's been 51 years now for this organization, and it's really evolved, originally from the grassroots of a passionate group of individuals that really had an interest in manual and manipulative physiotherapy, to the development of educational standards that should be part of this organization and guiding education around the world, to now where it has evolved and integrated evidence and research into everything that we do, and really try to upskill and upscale the organization from a governance perspective, from the integration and connection of clinicians and researchers, and trying to transform and transport that into our educational system, whether it is community-based programs, university-based programs that teach a variety of topics related to this, but also the growth of just the profession and trying to keep up with all of those changes. IFOMT's really trying to integrate the history into sort of the modern contemporary physiotherapists and the roles that we have at an organizational level, and also be globally representative and mindful of where everybody's at around the world.
Yeah, and I think that's a really important, comment. And I don't know that I really appreciated it until I came to some of the IFOMT conferences. So I was at Glasgow and then I was in Basel, and it's really interesting, to your point, to just see what's happening globally. A lot of times I think we're myopic in our own country or region. And so it's interesting to get together with this group and really see how things are moving, not just locally, but worldwide. What are some of what's the vision for IFOMT? Can you share a little bit of maybe the mission and vision and why it matters for musculoskeletal health worldwide?
Yes. So I think if you think about IFOMT's vision, and we're in the process right now of rolling out a new strategic plan, and we've just announced a new vision. And our vision is really a world where musculoskeletal physiotherapy transforms the lives of our patients and strengthens global health. We really want to try to take on a bigger role as physiotherapists. The opportunities there, we have sort of the skill set, the educational background, the will to be able to do this. From a mission perspective, in terms of our organization, there's a call for us to take on different roles and responsibilities, and we really want to promote and advance manual and musculoskeletal physiotherapy worldwide. And how can we do that? Well, we can do that by exchanging scientific knowledge. Mm-hmm. We want to try to encourage research and innovation and connect clinicians and researchers, and really try to support and foster higher educational and clinical standards, and really try to represent physiotherapists around the world internationally. And how can we do that? I think we can do that through collaboration and continuing to use evidence-informed practices and answer some of the difficult discussions and questions that people are having, but at the same time, to also not be afraid to say, we don't know, and we need to continue to build on that knowledge and motivate people to continue to learn.
Yeah, I think that's great. And some of my own observations are the collaborations that are happening across this organization with people in different regions of the world is really incredible. And I love that the vision is I see it playing out in real time, and I think it's fantastic. I'm going to turn it over to Megan to ask, just a couple of questions that she's interested about.
So Paolo, again, IFOMT has been, I love the word evolving. You have been highlighting that, the growth. hearing the needs and responding, right? I mean, I think that's a job of any organization, and I share that understanding. As obviously president of AAOMPT, you're learning, you're receiving, you're growing, and we're trying to constantly integrate what we're learning from an evidence standpoint into practice. And so let's dive a little bit more into maybe some standards in education, because obviously IFOMT has a huge role there, especially as the group that's, we have these standards, and these standards are used across the world, which is pretty important. And so IFOMT established rigorous standards for education and practice, especially for advanced musculoskeletal manual therapy. And so what does that process look like for a member organization? So maybe talk a little bit about that so they can understand, how do we get to be an MO, and why is that so important?
Yeah, thanks, Megan. And that's the foundation really for our organization. And it also makes us unique from other special interest groups within World Physiotherapy. We are the only one that actually has a standard by which countries need to meet that standard in order to be a full member organization. So what might this look like? This might be a country that is not part of our organization that has an interest in being part of this group, but also looking at the programs within programs. It could be multiple programs within that country, and looking at the curriculum that they have set and making sure that it meets the different competencies, pillars, dimensions that are identified in the IFOMT educational standards document. Now, what they do is they essentially compile all of this information, and with the work and assistance of some of the advisory groups that we have, and it's the advisory group on membership development, they would work really closely with that group essentially to make sure that they've got everything that's required there. At that stage of the game, it then is submitted to IFOMT, who has the standards committee and the executive committee essentially looking at that material, and the standards committee would independently, very closely and objectively compare it to the current standards document that we have. And essentially what they do is they provide some feedback on things that have met the standard versus things that that country maybe needs to work on. Now, if the application and those standards meet this fairly high level, rigorous educational standard that has been set, then what happens is the delegate assembly would vote on this country being part of the standards of being part of IFOMT. And at that stage, they would then enter into this international monitoring process, which is, one of the benefits of making sure that those countries continue to have these high educational standards threaded through their curriculum from that point forward.
Yeah, there's so much to unpack in that, because I remember when we got to vote on, some of these countries, and like there's such pride in that, like, right, like watching them go from a rig to an MO, and knowing that they've invested energy, time, and resources in some countries that just don't have as much time, energy, and resource. Seeing the passion of some individuals bringing that forward and carrying that along the way. I met with some of the groups, and that was really, really a unique experience to watch them, be announced as an MO, and the pride that you could see that brought. So, and then you talked a little bit about, the packaging, where you go and you're supporting them and the groups that are doing that. And I think this is where maybe you can talk about maybe the IM monitoring process a little bit more, because my question, and I think this is more from a worldwide, understand that maybe in the US, we're thinking about competency-based education. You all have talked about criterion-based education, different aspects of it. But how does IFOMT ensure consistency, maybe in these clinical competencies across all these countries and cultures that might have varying resources and supports? And so maybe you can talk a little bit about that and unpack that, what IM monitoring is after they become an MO.
Yeah, that's great. So essentially, and let me maybe preface it first by saying, the intent is to try to review the standards document in periodic segments. And we're currently doing that right now. And we're updating the standards document to, again, try to make it more contemporary, try to update it with the evidence. Much of the content that's in there already is still very, very good, but it's really to add more to it. Now, from an international monitoring perspective, as with the development of the new standards document, the processes are also under kind of review and development and being modified. Now, if we look at how does this normally happen? A country, once they become a member of IFOMT, they then undergo international monitoring approximately once every 6 years. And this is a pretty big deal. This is a really big job for the countries. It's fairly labor intensive. There's a cost, whether it's time or cost for the process undertaking itself. So I think as an organization, we need to rely on the national accreditation bodies that programs have, independently, some on a yearly basis. But every 6 years, what will happen is an external assessor essentially reviews and provides some feedback and input with regards to what their thoughts are on changes or modifications that have been done to those programs, and across all aspects of the program, not just curriculum. It could be, what did they do from the practical application sense? How do they deliver some of that content? That feedback from an external assessor then comes back to the standards committee, who obviously will compare it to, where were they in the past when they were either monitored previously, or if they were some country that was relatively new, they'll kind of monitor and again provide some suggestions on how and what they can maybe focus on for the next monitoring. Also, if there are some deficiencies, that would be flagged or that would be highlighted. Mm-hmm. And, moving forward in the future, the hope is we've got some really seasoned countries that they've been doing this for a long time. They're really, really well established, that have been monitored 4 or 5 times. So I think what we'll sort of see in the future is that some countries, it will be a little more of a streamlined approach. Others might have more of a directed type of approach where it was really this particular aspect that we needed to look at. Tell us about how that might be changed, versus others that might have, we've got a new program within this respective country that might be a bit more of a comprehensive type of a review. Essentially, by using that, that's how we ensure that all of these countries, with external assessors, with the standards committee, with the self-reflection process of those individual countries, that allows us to ensure that clinical competency is met and those high standards are maintained throughout.
Yeah, and that's, again, that's such a job for an organization to keep that high level standard. And again, when I say standard, it's that commonality across all these countries, that we can have trust and know that what you're doing in your country is similar to our country. And that's what I think the beauty is, and really appreciating IFOM's heavy work in that space, because I know it has to evolve too, right? Like, again, I appreciate kind of the pragmatic nature that I hear, the responsiveness, rather than this is the prescriptive approach. I might be wearing a little bit of an accreditation lens at times. And I'm like, man, sometimes this just could be a little easier. And so it sounds like you guys are making some thoughtful transitions in ways to kind of be responsive to needs, which I can appreciate. I'd love to take it another direction and maybe look a little bit more at a scholarship, but really evidence-based practice, as we think about scholarship, maybe a little bit more education. And we've talked a little bit about that, so we can dive into that. The education also then means evidence-based practice, how we're training people, how we're seeing things happening in the clinic. And as you mentioned, IFOMT really emphasizes evidence-based practice and looking at that integration into your standards and how we make clinical practice across the world to meet the vision. So how do you see research shaping education and practice of musculoskeletal manual therapy in the next decade? If you maybe can give us some thoughts there.
Yeah, so I think everything that we do is centered with evidence. We have to be clinically informed by what the best available evidence is at that time. But at the same time, I think we also need to realize, as clinicians, as researchers, as an organization, the limitations of the evidence, whether it's the designs, whether it's the interpretation of the information, whether it's the context. And the context could be so very different. If I'm in North America, if I am in Europe, if I'm in South America, Africa, Asia, wherever I am in the world, the context and the person in front of me is so very different. Yeah. And the makeup, we just don't have a one size fits all. And I think that sometimes we try to oversimplify the evidence, and we try to do that purposefully, I think, to try to get the message across to clinicians, to other healthcare providers, to our patients as well. But I think the evidence is really what guides everything that we do. And as an organization, in developing the standards many, many years ago, they were driven by the evidence and the research that was being performed in this, not even just in this space, but in other spaces, and just evolving the role of physiotherapy in all different conditions.
Mm-hmm. Yeah, and when you identify like person-centered care, and we're seeing the growth, you think about in person-centered care, where they came from, their environment and their cultures have such a huge impact because it even goes to external validity of any study, right? Can you relate it back to that population in which the sample came from? And if your cultures are vastly different, it makes it really hard to generalize some of those things. So that may be part of the reason we see a variety of results in different studies, again, and based on the populations in which they're sampled, which might be different countries for IFOMT, right? So that leads me to my next one, which is really, how does IFOMT play a role in really promoting kind of research in this collaboration model that we need to do internationally?
Well, I really think that the IFOMT is the conduit. It's the organizer that will sort of bring the different clinicians and researchers around the world together with a common passion or interest. IFOMT's developed several position statements that, relate back to, the cervical artery dissections or, challenges with the vertebral artery and vertebral-basilar system. That was maybe one of our first and sort of outputs that occurred. I think recognizing that we then need to be more that knowledge broker, that knowledge translator and disseminator, developing position statements around, recognizing red flags or serious pathology, recognizing, the use of pediatric manipulation, and continuing to sort of develop these special interests that really continue to inform different aspects of manual and musculoskeletal physiotherapy is sort of the role where IFOMT sort of helps to develop that. We also are a conduit where people can have a wider group to get different perspectives, as opposed to it just being I'm from Canada, just Canadian driven perspective. By integrating IFOMT, now we're able to have this global community of either researchers and collaborators that are directly involved in the projects or having the input from different perspectives around the world. And I really think that will continue to be a big role that IFOMT plays in different topic areas. And it could be topical depending upon what's going on at that time in the world. It could be something that we build on as the research develops. This also drives some of our speakers at different conferences that we have, or courses and workshops that people have. And again, it's IFOMT's ability to be able to connect some of those people, I think.
That's wonderful. Hey, thanks so much, because I know this would be a passion topic. We could just have one podcast just on this alone, right? So thanks for going to giving us your vision there.
Yeah, and I think it's really important to hear about some of these collaborations that have occurred really as a result of IFOMT organizing researchers and clinicians from different parts of the world to come up with some of these standards, because I think it's important that IFOMT is the body that kind of initiates some of these collaboratives. And you spoke about some of the VBI work, and then the Pediatric Manipulation Task Force. And a lot of those products, are the currency of this organization. And I think it's fantastic. And they're used, and I think, and adopted broadly because you're able to bring in people from different parts of the world. I think that's really important work. But I know with that also comes, challenges in terms of collaborating globally. And what do you think some of those challenges, but also opportunities are? Because this is really the organization that's trying to unite manual therapy standards and work globally. So again, what are some of the challenges that you see, Paolo, and what are some of the opportunities?
I think the biggest challenge is even at a professional level, meaning that the role and abilities of physiotherapists are different depending upon different parts of the world, and the education that they have to get to that stage. Some countries are still at a bachelor's level, other are at a postgraduate level, whether it's a master's or a doctoral level. So that creates quite a broad spectrum of entry-level physiotherapy that they have. Now, post-professionally as well, there's quite a variety of community-based versus university-based educational programs post-professionally. Now, we know that the curriculum within those programs meets the standards, so they should be at that consistent level. The different responsibilities and educational levels also align with national alliances with your regulatory bodies. So because, what you can do in one part of the world, you may not be able to do in another part of the world, kind of creates some challenges, especially when you're trying to either develop research that's trying to continually elevate what we do. Well, in some countries, they're not there yet. They may not be there for 5 or 10 years. So that creates both a challenge, but also an opportunity within those through advocacy, through demonstrating what they are able to do in some countries and the success, as well as the cost benefits that come with that. Some of the other challenges are obviously fiscal, meaning that there are some individuals that have infrastructure or funding that is available. And of course, we all know that with research, if you have some funds, it sometimes makes it a little bit easier. So those are definitely some of the challenges, but as well the opportunities. And I think with that, it builds other opportunities to educate and upskill some of the programs and physios around the world, or in some of the countries that are not even part of World Physiotherapy yet. Wow, what an opportunity we have as physiotherapists. And wouldn't you want us to be the people that are teaching them about manual and musculoskeletal physiotherapy, as opposed to trying to do this independently? Because they're not going to get there. It's going to be really challenging for them at the best of times.
Yeah. And I think what's my observation is that, countries can't elevate their standards of practice, without having access to people to help them get there. And so we did host on this podcast a couple months ago an individual from Kenya and then also from Uganda. And it was really interesting to hear about some of the challenges. But what I was pleased to hear is how they're leveraging people within the organization to help start moving the needle in some of these countries, to kind of elevate standards of practice and get them closer, both clinically and from an educational standpoint. So how does IFOMT currently operate with international organizations and other international groups? And then how do you think organizations like our organization, AAOMPT and IFOMT, can really continue to work together to advance the profession?
Well, I think one of the big things is many of our working groups, task forces, committees are made up of international individuals. We really try to be cognizant of trying to include, English, non-English, male, female, Western, Eastern, Northern, Southern individuals within the committee. So that allows, individuals that maybe would never have had an opportunity to be part of some of these discussions and initiatives, they now have that capability. The other thing is we also try to have sort of an idea of what's occurring regionally in the different areas. And this kind of goes back to our delegates. Our delegates that represent those countries will bring different concerns, challenges, opportunities forward to us. It doesn't mean that we have the answers, but we can sometimes disseminate them or connect them to other individuals in other countries that may have had similar challenges or experiences, and they can explain how they've handled it. With our 51-year history, we've probably seen it at some point in time. Yeah. And as such, we also have, files or notes that sometimes point to similar things. So we try to utilize that. The other thing is by working with other special interest groups, that we have some collaborations that we've done in the past and we'll be doing more of in the future. And they're approaching us, whether it's in, sports, oncology, looking at the older age group and fractures, again, developing those position statements from different perspectives, but also having these different groups or different parts of the world where we might have sort of regionally dedicated events in countries that maybe they wouldn't normally be able to attend an IFOMT conference in some big location because of the costs or prohibitive nature of travel and things like that. We've got an IFOMT Africa event, speaking of some of the African countries, in April of 2026. And our hope is to continue to try to do that and utilize the valuable input from AAOMPT, from all of the different organizations that really have done this for a long time, and continue to evolve, but they're evolving at a different pace than maybe some of our newer member organizations.
Yeah. And then how do you think our organization, AAOMPT and IFOMT, can come together and work together, even to kind of leverage what's happening globally?
Well, I think the big thing is, physiotherapists continuing to get involved, to put their names forward for different, whether it's national or whether it's international committees. And we have lots of individuals that are quite interested in, getting involved, but we also have some that are nervous, that are new to this, some that don't want to be involved, and that's okay because of capacity or other issues. And I think when we look at, AAOMPT and IFOMT's partnership over the many decades, it's been a real strong and important partnership. I think it's very important for us to always sort of be quite honest and upfront. We don't always, not just the organization in all countries come at it from a different perspective. And as has been the case even with AAOMPT and IFOMT, you're going to look at it from a unique perspective, and IFOMT will try to look at it from a global perspective. But I think that's the beauty. I think that's the perspective we need to bring, because it is very important for, me as a physiotherapist in Canada might be very different than the perspective that's happening somewhere else globally. And we have to understand that, try to find that common sort of language, interest, initiative, but at the same time, recognize the differences. And that's totally okay as well.
Yeah. I think that's really important. And jumping off from those statements, what do you see as some of the priorities then over the next couple of years? I mean, we've really gotten to see a number of, as you mentioned, task forces take shape that have some international representation, which are really moving some of the work forward. But what else is coming down the pipeline, Paolo, in the next couple of years?
Well, I think, the big thing, if we think about our strategic plan, excellence, continuing to promote excellence, continuing to use, these standards that we have, modernizing, making them evidence-informed with the contemporary literature, but at the same time, balancing that with equity and inclusivity. And what I mean by that is just making sure that we don't continue to evolve at such a pace that we forget about countries and programs that are at a different level, and giving them the opportunity to be part of this and try to come up with an idea to make it not prohibitive for whatever that might be, whether it is costs, whether it is location. I think we can do it. We've definitely learned ways of doing things. Empowerment, giving the clinicians, giving the teachers, the researchers, the ability to do this, and to do this in this larger community and collaborating at a global level, but also doing it professionally, compassionately, in a culturally sensitive manner, and always, above all, maintaining integrity and representing our profession as a physiotherapist in the most positive sense, and maybe leaving some of the agendas at the door, and again, really maintaining that professional integrity. I think those are some of the things that I hope to see, and continued growth in all aspects, research, growth in this, the representation around the world, and just in our role as an organization at a global level. And we're already seeing it and being asked for more and more involvement. And it's a really, really exciting time and a real opportunity. But it's going to come with challenges as well.
Sure. And I really like and appreciate how you really boiled this all down to the patient. There's a lot that happens at the level of an organization, but what you just said is really critical, which is, it's about all of us coming together to try to really optimize outcomes in terms of the human that's in front of us, that we're treating and managing. And it really does come back to the patient. And so I like that you kind of grounded us back in that. Speaking of the patient and the clinical interface that we have with patients, what's one piece of advice that you might give to clinicians that are striving for excellence in manual therapy?
Well, I think the big thing is you got to keep learning. I think what I'm sort of seeing sometimes in the new learners or new physiotherapists, and it's not just physiotherapy driven. I think we're in an age now where we can kind of look up things very quickly on our devices, but it's a world that is evolving at such a quick pace that you need to continue to keep learning, keep an open mind. There is so many things that we can kind of take advantage of, and try to continue to learn from the research, continue to learn from the different program and opportunities that we have, and try not to just get, don't let some of the paradigms that are shifting sometimes only in one direction modify the variety of things that you can offer to those individuals, and use them within the context of your setting, wherever you are geographically, with the person that's in front of you.
Yeah. Thank you for that. That's great. It's a great kind of close to this conversation. Megan, what would you like to add as we kind of wrap up our conversation with Paolo Sanzo?
Yeah, Paolo, so first of all, thank you so much for all you do, and just the leadership that you have given for so many years. And I think, you leave this kind of a conversation, hopefully our listeners will too, by feeling inspired by it. Like, right, there's a lot of questions around what's the role of manual therapy, and what does excellence look like, and how do we advance our professions, and what does collaboration look like, and why is AAOMPT a part of IFOMT, and like all the questions. And I hope that this conversation actually helps. Right, we see ourselves as leaders in the profession, and the opportunity to collaborate with other really incredible leaders to advance this as practice is such a unique way for us to really show our organizational alignment that helps you meet your vision, helps us meet our vision. And again, collaboration, I love that word. I think this is just the start of a lot of excitement. However, I will always say growth is hard, and everything worthwhile is uphill. And I know you have experienced that. We've been experiencing this for years. We're just grateful for your leadership as you're doing that work.
Well, thank you both for the opportunity.
Yeah, and I was just going to say for listeners who are clinicians or researchers or educators, I think if you haven't poked around or looked at the IFOMT website, there's so many incredible resources. And I think to Megan's point and Paolo's point, we're only going to get better and stronger if we have more context about what's going on internationally and not just in our own countries and our own regions. And so looking at the website, looking at some of the resources, I think it's a great way to continue to grow, as a professional in all capacities.
Well, thank you for, we've got two brilliant minds here on screen here, and thank you for all of the work that you guys have done in your leadership, in your research and teaching and all aspects. And again, I look forward to working again with you guys more in the future, and just all of the physiotherapists around the world, and those collaborations and friendships and the networking. That is probably the best part of everything that we do as well.
Agreed. Thank you, Paolo, for being with us today.
Thank you.
Thanks for listening to Hands On, Hands Off, the official podcast of AAOMPT. Subscribe now so you never miss an episode, and connect with us at AAOMPT.org or at AAOMPT on social. Opinions are those of the guests and not official AAOMPT policy. See you next time.